Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, April 13th, 2021, and almost a year and a half into this pandemic, and my goodness, things related to COVID continue to just be the top stories day after day after day. We are going to talk a lot about what we know and don't yet know about the Johnson & Johnson news this morning. I'm sure people have questions about that. I don't have all the answers, but I've spent the morning gathering what we do know, and I want to help you understand that. So as always, I think I didn't even introduce myself there. I'm Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health. This is your opportunity to get your COVID questions answered. You can put them directly into the box below, or you can use the hashtag AskDrArwady on Facebook or Twitter. And before we jump into your questions, as always, let's start with a look at our data here in Chicago. Chicago.gov/coronavirus, that's your one-stop shop for everything related to COVID in Chicago. And then if you want to see vaccine directly, you go to chi.gov/COVIDvax, or if you want to get directly to the dashboard, chi.gov/COVID-. So if we go to the COVID dashboard, let's pull this up here. So what we can see is that our cases and our positivity are still on the increase. We're currently at a 5.7% positivity. You can see a week ago we were at 5.1%. And our cases are now averaging about 691 per day, up from 599 per day a week ago, or up 15%. Our testing continues to be at a very good rate. We're averaging 13,629 tests per day, far above what our general testing target is, and about 4% up from last week. Our hospitalization data continues to really look quite good. We have a press conference this afternoon at 1 o'clock. And I'll be providing some more updates at that point related to what are we seeing in some of our hospital and ICU. All of that is available on the dashboard here, and if people have questions, I can pull it up and show some of that to you. We are seeing some small increases in terms of hospitalizations and ICU hospitalizations. We've not seen that turn into, at this point, an increase in deaths, and most of the cases continue to be in young Chicagoans, particularly younger white Chicagoans on the north side, although we are seeing cases rise across the whole city in every race, ethnicity, and in most of the age demographics, although we continue to see very good low rates in people in their 70s and their 80s, in the folks that are the most heavily vaccinated. I think I'll also just take 1 minute and pull up our vaccination data at a glance. If you're on, this is our vaccination page, and the first thing under data, just so you can see where we are here. We continue to make really good progress on vaccination. We are actually ahead in terms of coverage of among the 10 largest cities in the US. We're leading the way in terms of coverage, and we have now about 37% of all Chicagoans have gotten at least a first dose, but 46% of Chicagoans 18 plus have gotten a first dose. And you can see for all Chicagoans, more than 1 in 5 now have gotten a first dose, 21.1%, and more than a quarter, 26.6%, have gotten both doses. So, you know, we've got more than a quarter of Chicago adults fully vaccinated at this point, and we're closing in on half of Chicago adults haven't gotten that first dose of vaccine. So really good progress, still not where we need to be, but these are going up very, very well. The one number that continues to concern me is that relatively lower coverage among people 65 plus. You can see we've got about 62% now of Chicagoans over 65 have gotten a first dose, and about 47% have full coverage, which is a lot, but not as high as I would like it to be. That's the one number that still gives me a lot of pause. So I encourage you to explore. We have data on here by zip code, we have it by race, ethnicity, we have it by age breakdown, and but every area of the city is making very good progress. And not only are we really doing the best in terms of coverage, our equity data, particularly for Latinx Chicagoans, is far outpacing what we're seeing in terms of coverage for other large cities. And among Black Chicagoans, we are lagging a little more there compared to what we are for Latinx Chicagoans. But still, the last time the epidemiologist looked at, you know, we were second in terms of coverage among those largest cities. So still a lot of work to do, but I'm really pleased with how the rollout's going. Our efficiency numbers continue to look great. We're getting more than 90% of our vaccine into arms within the week. So I think that is enough related to data. And already, let's go ahead and turn to some questions. Getting questions about the J&J announcement. So why don't I maybe start with just a high level, what we know, and then we'll get into some specific questions. So, vaccine safety from the beginning always is our top priority. And you've heard me say that. We look at safety, that's why we do the clinical trials. And in a lot of ways, this announcement today from the CDC and the FDA really putting the Johnson & Johnson vaccine administration on pause is a nod to that really high commitment to safety. I do think it is the right decision while the teams at the federal level investigate this data. In case people have not heard, there are very rare, extremely rare reports of some individuals who had unusual blood clots, and we can talk about what that is, in the setting of low platelets. And there were 6 people who had this really unusual, severe side effect in the context of about almost 7 million who have gotten the Johnson & Johnson vaccine. So we're talking about something that we've seen, 1 in a million, which is obviously not a common event in any way, but still, it's a really unusual thing to have seen. And we can talk some more, explain what that is. And so in that setting, the FDA and the CDC asked for Johnson & Johnson administration to be paused while they investigate. Tomorrow, the CDC's Advisory Committee on Immunization Practices, the ACIP, that makes the recommendations for administering vaccines, all vaccines here in the US, will be meeting in an emergency meeting that will be open to the public if you want to see it. And that group will be considering the data in more detail, and then we'll be making recommendations about whether there need to be any changes in terms of labeling or messaging or recommendations for who should get this vaccine. And so already we're getting a few questions, right off the bat. I got the J&J vaccine yesterday. Should I be worried? So the Johnson & Johnson vaccine, as a reminder, is the vaccine that is our single dose shot. So if you got the Johnson & Johnson vaccine, you may be having some of the side effects that we do expect in the sort of 1 to 2 to maximum 3 days after vaccination. And that's anything from feeling tired or having a headache or having a sore arm, in rarer cases, fever, etc. That is not what we're talking about here. And maybe to talk in a little bit more detail, and then we'll come back to it. So. And I see here, some more questions about the details of what this means. So, someone's asking, what is the medicine behind the J&J complications? What will the hold on J&J vaccines mean for the rate of vaccinations in the city? I see one here. What is this kind of blood clot? Okay, so the 6 cases that have been reported at this point are across the whole country. None of them are in Chicago. None of them are in Illinois. And we've been looking at our records and not seen anything of concern at this point related to blood clots or to low platelets locally here. But one of the reasons why the decision was made to put this pause and to announce this was so that clinicians, doctors who are treating patients, know to look for this as a potentially rare side effect, and then to report it so that it can be fully investigated. And the complication that we're talking about, it's this rare but severe form of blood clot that is happening in combination with low blood platelets. So let's take a step back. What are these low? What does it mean to have low blood platelets? What does it mean to have a clot? So when you cut yourself, you know how it starts bleeding right away and then eventually it stops? It is your platelets that help that bleeding to stop. In your blood, you have red blood cells, which carry the oxygen. You have white blood cells, which help fight infection and other things. And then you have platelets. These are the three main things. And the job of platelets is to help keep your blood to help it clot if, for example, there's a cut, and to help it not clot if everything is going fine. So it's literally related to that, and it's important that we have platelets, because otherwise, if you bruise yourself or cut yourself, a small bleeding event could be really critical. And so, number one, there are rare cases not associated with vaccines of people having low platelets for all kinds of reasons. People will get low platelets because they have cancer. People will get low platelets because they have a reaction to a medication. People will get low platelets for sometimes reasons we don't understand at all. We call it idiopathic. And sometimes people will get low platelets as a result of an immune response. And I used to take care of patients in the hospital, and we would see patients with low platelets. And when they have low platelets, you have to, you treat them. You give them medications that actually help tamp their immune system down, and you wait for their bone marrow to sort of start making platelets again. So we've got one issue of low platelets. Rare at baseline. It can be a big deal, but we see it. And that in and of itself would not necessarily have caused this decision for a pause. The other thing that we see rarely, but with some frequency, are blood clots. And I'm sure many of you know people who have had blood clots. We have somewhere between 500, 600,000 people with blood clots in the US every year. And, I used to work in the emergency department. Pretty much every shift in an emergency department, you might see someone come in with a swollen leg or feeling short of breath, and you'd need to do a workup. And some of the time they'd have a blood clot. And again, blood clots can be caused by a whole range of things. They're known to be associated with cancer, with smoking, with long car rides where people are not moving around. And again, there's other things that can put you at risk. So blood clots in and of themselves are rare, but not ultra rare. The reason why they decided right now to put this on hold is because of the particular kind of blood clot that they were seeing, and that this blood clot is in combination with low platelets. And it's pretty unusual to have blood clots in combination with low platelets. And in this case, the clots themselves were something called, these are big words, but it's called cerebral venous sinus thrombosis. And if we break that down, cerebral means head. So in the head, in and around the brain. Venous sinus, it actually means the part where blood is draining from your brain, and then thrombosis means a clot. So these people were getting blood clots, not just in their leg, but they were getting blood clots, that was draining from their brain, and that can be really serious. And so in these 6 cases, again, a low number, they were all in younger women between the ages of 18 and 48, and they occurred anywhere from 6 to 13 days after vaccination. So not immediately, not right when they got the needle in, not in the first couple of days, but in the sort of 1 to 2, maybe up to 3 weeks after. And to get a blood clot in your brain is obviously serious. One of these 6 women died, and one is, I believe, in the ICU or is in critical condition. And so even though this is rare, in this case, having seen 6 cases of people having this blood clot, in a severe area, combined with having low platelets, these two rare events together was unusual enough that the CDC and FDA made the decision to put further vaccination on hold while they investigate further. This doesn't mean that we will never administer Johnson & Johnson vaccine again. It doesn't mean that this will be indefinite, but they will want to understand, was there something that these women had in common that maybe made them at more risk for this? We don't know for sure that it was related to the vaccine, but having these 2 rare events together, was more than you would expect. And this is exactly why, to my mind, this is why we have the really good sort of safety and monitoring protocols in place at the federal level. The initial safety is all done, all of this is done in the trials, and there was, I understand, one case in the trial of a similar presentation like this, but that was not unexpected in terms of how often we might see this in the background population. But now, after about 7 million, 6 cases, although very, very rare, is still higher than what you would expect. And so the other reason why they made the decision to make this announcement is that typically, if somebody has a blood clot, like if they come in with a clot, there's a common medication, it's called heparin, that you would start people on with a clot to help break up that clot and help get the blood flowing again. But when somebody has low platelets, you can't give them heparin. It actually could be dangerous. And so it was important, and I think this was right too, that they get the information out for doctors so that if someone is coming in with either low platelets, again, which we see, not related to vaccine, or with a blood clot, which we see, not related to vaccine, that they make sure to ask about the history of vaccinations and then test potentially for both of those. And then if it was in the setting of having received the Johnson & Johnson vaccine, the FDA obviously wants to hear about it, the CDC wants to hear about it, so that we assess whether this is a more significant problem, whether this remains very rare, and we just want to share some more information. So when the ACIP meets tomorrow, they'll look at the data, they'll likely make some more recommendations, and back to this question about should I be worried if I got the vaccine yesterday? You should not be severely worried at all if you got the Johnson & Johnson vaccine. Again, this is very, very rare, and there's nothing that you need to do differently. But we do ask, in this setting, just as you would, be monitoring your health, and really not in the first 1 to 2 days afterwards, but if, up to about 3 weeks afterwards, if you were to get a severe headache or abdominal pain or leg pain or shortness of breath, these all could be signs of a blood clot, and we want you to seek medical care and then tell the provider that you had the vaccine, and they'll know what to do from there. So I think it is the right thing in terms of wanting to make sure that we understand if there is a link here, and if there is, there could be some recommendations around specific subgroups that we may not use this vaccine. Vicky Woods is saying, I got my first Pfizer shot 1 week ago today. With the recent news about J&J, I do not want to go back for the second shot. I was hesitant to get any COVID vaccine in the first place, and this makes me more skeptical about any vaccine that is still being followed and studied. I understand that I'm still somewhat protected. Is this true? Okay, that's a really good question. And, I fully know that people, will feel nervous about vaccines regardless of whether they, which one they got. I want to be really clear that in no way is this related to Moderna vaccines or Pfizer vaccines. The federal government has been looking really closely, and they had 0 reports of this condition in anybody who got the Moderna vaccine or the Pfizer vaccine, and we're talking about 180 million doses there, right? So this does not seem to be linked to Moderna or Pfizer at all. If this is sounding a little bit familiar, and one of the reasons why I think the scientists had their antenna up is that it's somewhat similar to what we've been seeing in Europe with the AstraZeneca vaccine. Though the AstraZeneca and the J&J vaccine both use what's called an adenovirus, there's a different technology for how that vaccine is made. It is not the same way that Moderna and Pfizer are used. So I would really encourage you to go back and get your second shot. And that would be true for Moderna, that would be true for Pfizer, because, in the trials, you do have some protection, that's correct, after that first dose. In the trials, it was about 50% protection. There's been some work afterwards to suggest it could be somewhat higher. But to get to that, 90-95% protection level, you do need both doses. And my worry here is not not so much at an individual level, but about, understandably, people will hear this and be concerned. So, you are somewhat protected, but I would recommend that you get your second dose, and that anybody, keep your Moderna appointments, keep your Pfizer appointments. The J&J, again, is going to be on hold for right now while this is further investigated. And this is actually, relatively standard. If you remember, right when vaccination started in the UK, they paused all vaccination because there were some of these allergic reactions. And then we changed the way that we monitor for allergic reactions and, restarted vaccination. And that is where we are here with this one, at a point where they're looking at it to get more details. But, I would really encourage people to continue with getting Moderna and getting Pfizer. They remain the most important way to protect yourself. And remember, I know it's very scary to hear about people getting blood clots. These 6 women getting blood clots among the millions, but we also have seen, so many bad outcomes from COVID itself. And vaccination absolutely, remains, particularly with the Moderna and Pfizer. There's no signal that there are new safety concerns with that. The efficacy remains really good, and I have every confidence this in no way has changed my opinion at all about Moderna or Pfizer, and they do use a different mechanism than J&J. All right, so a couple of questions about how does this affect operations. Allie Tierney Halverson is asking, what will the hold on J&J vaccines mean for the rate of vaccinations in the city? We've got another one, what is happening with the homebound program in light of the J&J news? Yeah. So Moderna and Pfizer vaccines have been the predominant vaccines for a number of months, right? You've heard, I just said there's been about 180 million vaccines across the country, give or take, with Moderna or Pfizer, and there's been about 7 million with Johnson & Johnson. It's a much, newer vaccine. Many fewer people have gotten it to date. And we had already seen a big drop-off in what was allocated for Johnson & Johnson here in the city because there were these problems with the production plant in Baltimore. And so last week we received about 40,000 doses of Johnson & Johnson, and this week already we were receiving fewer than 5,000 doses of Johnson & Johnson. And so we had already we had spread out that 40,000 a little bit. We did have a lot of plans for Johnson & Johnson, which are on pause right now while we wait to hear about this. And why don't I just talk through what some of those are so people get a sense. Number one, we have been using Johnson & Johnson for our homebound program. This vaccine is the most important. Any vaccine that you can use that doesn't need the ultra cold, doesn't even need the frozen, is by far the most appropriate for programs like homebound, programs like going to rural areas, international programs. And so the homebound program will be on pause. Again, I expect this to be a relatively short-term pause while the scientists look at the data and then make some recommendations, and we'll share some more. We actually had been in the process of ramping up our homebound program. Our call center had already reached out to, I think we'd gotten through about 60% of the around 5,000 people who had signed up to explain to them what was happening in timelines and get people scheduled. But that will be on pause, at least for this immediate moment, until we get some more information. And the concern does seem to be more among younger people, but I'm not going to get ahead of the experts who will make the recommendations. So that's on hold. Some other things that are on hold. We know there's been a lot of demand for Johnson & Johnson. So some of the sites, we've been using Johnson & Johnson at O'Hare and with the airlines there. So that is on hold. We've been using Johnson & Johnson at Chicago State University. We didn't have anything scheduled there today, but we will be putting that on hold or potentially switching to Pfizer or Moderna. That's the other point here. But it depends a little bit. We don't have vaccine sitting on shelves. We push it all out, and we get vaccine once a week. So we'll be making some more announcements about that. But I'm really committed, particularly to that Chicago State site because it's on the far south side, one of the regions where we're seeing lower vaccination uptake. It also affects some of the work that we've been doing with employers and some of the unions. And so we've been reaching out, to let folks know those are on hold. We had an event, planned with the Illinois Restaurant Association today, for example, for restaurant workers. All of these, right now, any Johnson & Johnson doses are on pause while we get some more information. And after the ACIP meets tomorrow, after we get some more information, we'll be sharing details about what this looks like. We certainly, these groups that we've chosen for vaccine clinics and prioritization remain prioritized groups. So we may need to do some juggling with our next influx next week of some of the Pfizer and Moderna, or there may be new recommendations around J&J. Also the bus, right? That's the vaccine bus we've been really excited about that's been going out, not appointment-based, but to some of our hardest hit areas, letting people do walk up, and something that we absolutely want to expand in a more long-term way. All of these are things that will be impacted, at least in the short term, as a result of that. So I expect not just in the city, but across the country, we'll see some drop in the rate of vaccinations as a result of this. And when we get some more details, we'll see what that means. Okay. Richard Benson. Oh, this is a good question. A double vaccinated, I presume that means 2 doses, friend of mine tested positive for COVID recently. Should that person tell the health department they were vaccinated? Does someone do data reconciliation in the background to figure out if vaccinated people test positive? Or do we expect some vaccinated people to occasionally still get COVID and test positive, and this isn't a big deal? Yeah, I love this question. This actually is something that, as you note, there is a lot of data reconciliation happening in the background. So let's talk through this all the way. So as a reminder, you're not, none of these vaccines are 100% protective against COVID. So as you say at the end, do we expect some vaccinated people to occasionally still get COVID? We do expect some vaccinated people to occasionally still get COVID. And for example, in the long-term care facilities, we've been tracking this really closely. We do a lot of testing still every week in those facilities, even though there's been a lot of vaccination. And we have identified some, they're called breakthrough cases, when we have people who are fully vaccinated and still get COVID. The good news is it's very rare for them to get seriously ill. Even in those long-term care facilities, at this point, we haven't had anybody fully vaccinated need to be hospitalized or died, even if they test positive from COVID. And in fact, a large percentage of them have been asymptomatic, but have been tested, because of being in a high-risk setting. But nevertheless, so the team for a long time now has been doing additional follow-up whenever, first we look to see if we see somebody diagnosed with COVID a long time apart from each other, right? Because there's this question, even leaving vaccine aside, if somebody had COVID once, a year ago, and then they test positive for COVID again 6 months later, there's some question, right? They've been reinfected. Could that be a variant? What could that be related to? And so for a long time, we've been tracing those, and if we identify somebody who gets COVID, who seems to get COVID a second time, we do some additional investigation there. Where possible, we're looking at those samples for variants or looking for other issues. And now that vaccination is in the picture, we match every one of our COVID cases. We sort of match it against vaccination history. And if we identify someone who has been vaccinated and gets COVID, either after a first dose, after a second dose, or especially 2 weeks after a second dose, which is when you're considered fully vaccinated. We do flag those for additional review. We are interested in particular in those, again, could there be a variant? Could there be something different going on? And we have a team that works specifically on breakthrough cases. So, it's been a small number of these. The vaccine remains hugely effective, but it is something that we definitely look into. So if your friend is a Chicago resident, we would be aware, and they got vaccinated in Illinois, we would be aware and would already be looking into that. it's been an important question. We've been on calls with CDC about this too, because especially if we have a breakthrough case and it turns out to be a variant, right, that has the potential for significant public health impact. However, all of the vaccines right now remain protective against all of the variants, and for everything related to variants, getting your vaccine soon, getting both doses of your vaccine if you're getting Pfizer or Moderna, and then even if you've been vaccinated, continuing to wear your mask when you're in public, because your chance of getting COVID if you're exposed goes way, way down, but it doesn't go to zero. And so that's why while COVID remains high, when people are out and about, unless you're with other people who are fully vaccinated, we do need people to keep being careful. And that's how we keep the risk down for everybody, and that's how we keep variants from spreading. Okay. Durgam Ghazali on Facebook. Do they have enough syringes, or are they reusing syringes? We have enough syringes. So nowhere in the country, I guarantee nowhere in the country is anybody reusing any syringes for vaccine. It is a #1 rule when it comes to vaccination that you must use a new syringe for every person. And in fact, every time we deliver vaccine, it comes with the appropriate syringes and needles and all the things that you need to do safe vaccination. So no chance that anybody is reusing syringes for vaccination here in Chicago or anywhere across the country. Okay, Brenda Neves LeBron on Facebook. Now that we are open to vaccinated ages 16 years and older, the only one available for over 16 that's approved for that age is Pfizer, which is correct. Where can I schedule an appointment for my kids that are high risk? Their healthcare provider only has Moderna. What will be my next stop if there's no Pfizer at Walgreens or CVS? Okay, good question. So let's back up a little bit just to make sure everybody understands where we are on that. And you're exactly right in your question. So only one of the 3 vaccines has been approved for use, has gotten emergency use authorization for 16 and 17-year-olds, and that is the Pfizer vaccine. You cannot give the Moderna vaccine, you cannot give the J&J vaccine, even before this pause, to anybody under the age of 18, because the studies were not done for younger children. Pfizer, about 3 days ago, actually submitted its first data for 12 to 17-year-olds, or 12 to 15-year-olds, but added on additional 16 and 17-year-olds to the FDA. So the FDA is reviewing this data in adolescents for Pfizer, and the preliminary information looked very good. There were no side effects, no serious side effects. There were 100% protection, and in fact, the antibody levels, when you check in the blood, is somebody protected against COVID, were really good. They were even better than they were in young adults. And it was using the same dose of Pfizer that had been used in adults. So that was good news in terms of that continuing to make progress. The FDA, though, has not made that approval yet. And they're going to look at this really closely. So I would guess it's still going to be, I don't know for sure, but my expectation is it'll be more like summer, maybe early summer, though, given that they've turned in this first data, that we may be able to see some vaccination available for adolescents. However, get to the crux of your question, because neither Moderna nor J&J can be used for kids, Pfizer is the vaccine that is the hardest technically to use. It's the one that requires the ultra cold storage. It's the one that generally requires pharmacists. There's a lot more mixing that goes into it. And it's the one that from the time that you pull it out of ultra cold, you only have 5 days to use the doses. And so it is not an appropriate vaccine really for outpatient providers. And so our outpatient providers, our clinics, our federally qualified health centers, most of our events tend to use Moderna or Johnson & Johnson. And so where we are right now, and then the other piece is that in large mass vaccination sites, there's a lot of additional requirements around vaccinating people under the age of 18. There needs to be parental consent while it's under emergency use authorization. There's a lot of logistics around it. And so the city of Chicago pods at this point are only open to people over the age of 18. But we've been working already to make sure that the hospitals that see kids with underlying conditions, so whether that's Lurie or Advocate or any of them that take care of a lot of kids with underlying conditions, they have already been vaccinating 16 and 17-year-olds with Pfizer. And we're in discussions about plans to expand some more of that, especially a little bit later in the spring or summer when there's going to be more vaccine availability and we're not still, hopefully we've got more of our very highest risk folks done. So I would encourage you, at this point, it's likely to be really through a hospital-based provider because that's who has Pfizer. Down the line, we may do some child-specific, what we call points of dispensing with the parental consent and all of this in line. I am very hopeful that Moderna will soon have the data for adolescents to be able to submit, because being able to get this vaccine out to pediatricians and out to our really robust network that we typically use for vaccinating children and adolescents is going to be really critical. I remain confident, based on what we know now, that we'll be able to be vaccinating at least adolescents this summer. It'd be great to have the bulk of them vaccinated before school starts, for example. But at this point, we're still waiting for trials to finish, and there is not a vaccine authorized for kids under 16, and the ones that are easier are not yet authorized. So if you are able, there are some sites and again, we, as availability of vaccine improves, there will be some opportunity to expand some of this. But there are some mass vaccination sites outside Chicago that will take 16-year-olds. And there are definitely, through the clinical setting, which will be expanding out of some of the larger children's hospitals, there will be opportunities there. Aaron Hoffman on Facebook: how long after the J&J vaccine did those 6 people develop blood clots? So all symptoms were between 6 and 13 days after. So not right away after, not a month after, in this kind of 1 to 2-ish week period. The median number of days was 9 days. Don Wolf on Facebook: what should Chicago restaurant workers and others in 1C know about pausing the Johnson & Johnson vaccine? Just that if you had a J&J vaccine appointment scheduled, in the next few days, we will not be using Johnson & Johnson vaccine for that. As we get some more information, I think we'll have some more even tomorrow. We'll be able to share some more details about what's possible. And as we learn more about what our vaccine allocation may look like in this setting, we'll be making some decisions about, Chicago restaurant workers, certainly, they were supposed to be an event today with Johnson & Johnson. We'll be working to see if we can perhaps redirect some of the Pfizer or Moderna. But this is a hit, no doubt about it, in terms of, we have a lot of commitments already for vaccination, and the timing is bad where we're expanding eligibility. So, Sandra Students on Facebook: I'm an essential worker. I work at Walmart. I'm scared after seeing these bad side effects. I want to know, how beneficial is the vaccine? So the vaccine remains special, nothing bad here about the Pfizer and the Moderna vaccines. It's really beneficial because it's basically, all of these vaccines have been essentially 100% protective, just about, against hospitalization or death. And when we think about the major effects of COVID, right, the worry is not so much if people get a mild infection. The worry is that we've seen, 500,000 people more in the US die from COVID, and these vaccines help protect in amazingly effective ways ways against hospitalization and death. So I strongly recommend, if you're an essential worker and you're working at Walmart, you're probably interacting with the public, you should get a COVID vaccine. That remains my very strong recommendation. Best way to protect yourself, your family, and Chicago. Right now, not the Johnson & Johnson vaccine. Well, we learned some more, but you should get a Pfizer or Moderna vaccine. Donna Scafidi Cameron from Facebook, with the new information about the J&J vaccine and blood clots, is this affecting women only? Do they know why? Does it have anything to do with estrogen? It might. At this point, 6 cases is really tiny compared to, again, the almost 7 million that have gotten this vaccine. But I don't think it's a surprise to see something that could be related to an immune reaction affecting women. We know that autoimmune diseases generally are much more prevalent in women, and that's because women and men do have differences in their immune systems. Many of the immune modulating genes live on the X chromosome, and if you remember back to high school biology, women have 2 X chromosomes and men only have 1. They have X and Y, and so there's more opportunity for sort of different genetic things on X chromosomes in women as compared to men. But also, estrogen does tend to be a bit of an immune modulator in a positive way, and then testosterone in a bit of a negative way. And because women need to evolutionarily be able to have babies, there are reasons that you don't want their immune system rejecting a fetus, that kind of thing. So we know women and men have different immune systems, and at this point, it has all been identified in women. In Europe, where there have been some similar concerns related to the AstraZeneca vaccine, it's not all been in women, but it's been like 2 to 1 or even more in women. So there is probably some actual predilection there. Okay, I think we are coming up on time. Maybe we'll take one more. Jenna Martin on Facebook. Can you get the second dose of Pfizer earlier than 21 days? I got scheduled a little bit earlier. And is it 21 days from your first shot? So, the CDC has said, and the ACIP have said, you should aim for 21 days for Pfizer and 28 days for Moderna, but there's a grace period of 4 days earlier if you need to for either one. So as long as you're getting it, 17, 18, 19, 20, in that 4-day period before your date, that's perfectly acceptable for either of them. And then similarly, if you can't get it right on time, you can get the second dose up to 6 weeks after that scheduled date. We really encourage people to get that second dose on time. That's how the studies were done. That's also how we allocate vaccine. So, we give your provider the amount of vaccine that they need to do second doses for everybody they did first doses for, 3 or 4 weeks earlier. And so you have the best bet of being able to get that vaccine held for you if you get it on time. But yes, there's a grace period of 4 days early or up to 6 weeks late if you should need it, and there's no need to restart vaccination or anything at that time. Okay, I think this is going to have to be our last question. Deborah Vinicos on Facebook. Is the variant B117 dominant in Chicago? I saw a CDC chart that seemed to indicate we're seeing more P1 in Illinois. So B117 is actually not dominant quite yet in Chicago. It is dominant across the US. And some of this, there's some limited, we don't test all of them. But what we think is that we probably are now seeing a little more than half of the cases in Chicago of a variant of one kind or another. But it's a combination of all of the different variants, with B117 being a portion, by far the largest portion of those. And we are definitely seeing some of that P1. It is much less than the B117, but we are seeing a little more of it here in Illinois than anywhere else. And perhaps, I think we're out of time, but on Thursday we can share some more details about what we know about variants. Bottom line though, all the vaccines are protective against the variants, and especially the masking, the distancing, especially with cases on the rise. Those are also protective against variants. Where we get into trouble is when people let their guard down. So please, 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 even with all of this attention on the J&J vaccine right now, this has not shaken my confidence in the safety and efficacy of the vaccination program broadly in the US. Really encourage people, if you had a J&J appointment, if you can get a Moderna or a Pfizer, we're going to work to figure out what we can do in terms of supply to be able to make sure people can access vaccine. And, I'm sure people will have additional questions. Put them in. We'll be back on Thursday. We'll talk some more about variants then. And by then, we'll probably have some more information about this as well. So our goal, always, vaccine safety, promoting vaccine efficacy, and then being as transparent as we can be with everything as we learn about it. And that's what we'll keep doing here. We'll see you on Thursday, 1 p.m. today. If you're interested, we will be doing a press conference to be able to get some of this information out a little bit more formally, including where we are. And feel free to join us at that time. And otherwise, we'll be back to get more of your questions on Thursday at 11 a.m. Take care.